And right now, we'll take you live to the Ontario Legislature, where question period is now underway. Let's listen in live.
6,000 for cataract surgery, another 7,500 for a manual process and pushed into taking upgraded lenses. This is already happening in private clinics, and the government is working to expand it. What does the Premier have to say to these patients?
To reply, member for Eglinton Lawrence and Parliamentary Assistant to the Minister of Health.
Thank you very much, Mr. Speaker, and thank you to the member opposite for the question. Obviously, there have been reported cases, and we heard some of them this morning, but Speaker, if Bill 60 is passed, what was previously called an independent health facility will now be called an integrated community health service centre, and under the oversight of Ontario Health, which reflects our intention that these clinics be integrated with our public health care system. So we are expanding oversight by bringing in this new legislation. Integrated health centres will now have to post any uninsured charges, both online or in person, and every community surgical and diagnostic centre must have a process for receiving and responding to patient complaints. The new legislation is remedying a problem that has existed in public hospitals as well as clinics, and it is making sure that these things are posted so that people cannot be upcharged.
The supplementary question.
So Premier, just gouging patients, but more transparently. That's kind of what I got from that answer. Speaker, the Premier owes these patients and all of us an explanation, and I have so many examples right here, which I will share with the Premier. Here's the thing, and back to the Premier, for-profit healthcare, like the kind that's being pushed by this government, requires a return on investment. And that money is going to come from two places: extra charges to the public system that we're all going to pay for, and upselling directly to patients at a time when they're at their most vulnerable. While the cost of everything just keeps going up, Speaker, why is this government opening the door to new fees and charges on people who are just looking to get the medical care that they deserve?
Member for Eglinton Lawrence.
Thank you, Mr. Speaker, and thank you, the member opposite, for the question. I think the question proves why you should vote for Bill 60. Bill 60 is going to make sure that these protections are in place for patients. But look, I mean, honestly, Ontarians will never have to pay under a Doug Ford government for services that are OHIP insured, and that's what we've committed to.
Order.
Ontarians will have these services, and we'll be continuing to fund one of the largest publicly health-funded systems in the world, publicly funded healthcare systems in the world, $77.5 billion this year alone, and that's an additional $14 billion invested in healthcare spending since 2018. We're working with all of our partners to identify innovative solutions, such as these clinics, to expand access, because that's what this is about, making sure people get timely access to care when they need it.
The final supplementary.
Thank you, Speaker. This government wants us to believe that there's going to be transparency and accountability or protection. All you have to do is look at what the government did when they attempted to hold and did nothing to hold private for-profit long-term care owners accountable for the horrific conditions and loss of life we saw during that pandemic. In fact, I'll remind the government that those operators were rewarded with 30-year licenses. Now we're supposed to trust that new and expanded for-profit clinics will have oversight, even though there are absolutely no details in the legislation. To the Premier again, why is there no commitment to transparent public oversight authority in your legislation?
The Government House Leader, Minister of Long-Term Care.
I'm glad the member opposite brought up long-term care, because she will know, of course, that just on Friday we introduced the fact that we had hired an additional 200 people for long-term care, doubling the amount of inspectors like we said that we would do, Mr. Speaker. Now, we said that we would have the highest inspector-to-home ratio in the country, and we do. The other opportunity that the NDP had to vote in favour, and they voted against it. We said we would build 58,000 new and upgraded beds across the province of Ontario in small communities, large communities all over the province. They could have voted for it, but they voted against it. The member voted against long-term care in her own writing. Now, of course, we're also saying that we're going to improve health care in the province of Ontario. Now, we started in 2018 with Ontario Health Teams, the transition. We're continuing with billions of dollars in new investments, and we're making health care more open to the people of the province of Ontario, giving them more opportunity to have care closer to home. That's what we're doing. We're building a healthcare system that will work for Canadians and Ontarians today and well into the future.
The next question.
Okay, healthcare is the hot topic inside the Ontario legislature this morning, where the NDP is worried that Bill 60 is going to be detrimental to patients and that these private clinics will try to upsell them on services. But the Ford government saying that there will be a patient complaint system at each of these clinics to kind of monitor what's going on, to which Marit Stiles, leader of the NDP, says, quote, gouging patients more transparently.